Happy Wednesday, happy hump day. Let's get right to it, shall we? Today is von Willebrand disease, which is a rare but significant bleeding disorder that can pose great challenges before, during, or after pregnancy. So what is von Willebrand disease? It's a bleeding disorder. It's a dysfunction of a particular factor, of course, called von Willebrand. It's a protein that plays a crucial role in blood clotting. So about 1% of the unselected population of both men and women will have the diagnosis. Clinically significant disease is estimated to be about 125 per million, and severe disease can affect up to 5 per million. So, as you can imagine, in pregnancy, when the body is changing, it can affect the delicate balance of clotting versus bleeding, homeostasis. Women with von Willebrand disease are at higher risk of bleeding during childbirth. If they have the more severe form, they can have an increased risk of miscarriages. And of course, any kind of bleeding during or particularly after delivery of the baby, postpartum hemorrhage, can occur. And so this is why it really does emphasize that we should have careful management of this disorder. So how do I know what needs to be done, and how do I know? Usually the history will tell. If from the first time you've recalled with your periods, it's always been long and heavy, and your doctor has told you that you're anemic, or maybe one day out of the blue you have recurrent and excessive spontaneous bruising, such that somebody kind of look at you like, who's been beating up on you? And or is there a family history of bleeding disorders? If you have any of those three, I would suggest that before you even consider getting pregnant, you should be screened for von Willebrand's disease. A visit to your hematologist, you do need the specialist. Your primary care would be more than happy to give you the referral. Once diagnosed, close monitoring with a combination of experts, including but not limited to hematologists, maternal fetal medicine specialists, obstetricians, that is essential throughout the pregnancy. If you have a bleeding disorder, it's not advised that you go with a low risk provider, because you're not low risk by definition. We can plan for certain medications. Desmopressin is one such one, which we can combine with von Willebrand factor replacement therapy. That's usually reserved for women who tend to have low factors or have this severe disease. It is important to know that one size of in treatment does not fit all, and so treatment plans are geared towards individual patients based on the severity of their condition and their specific needs. In summary, women with von Willebrand disease can have safe and successful pregnancies with proper management and close collaboration amongst the healthcare providers and between the healthcare doctors and the patients. In raising awareness on this bleeding disorder month, we can continue to educate about this condition and advocate for comprehensive care, so we can ensure better outcomes for mothers and their babies. So this is Dr. Heather, your pregnancy specialist, Wishing you a wonderful Wednesday. Want you to walk good. I'll talk to you soon. Bye.